Hello, everyone. This is Dr. Isabelle Amigues. I'm your friendly rheumatologist, and I'm live from Denver, Colorado. And I'm trying to go live on Instagram, and bam, I think it's here. So today, yeah, I had quite a bit of interesting recently questions about COVID. And so I wanted to basically share some information with you as a rheumatologist. Also want to share some facts about COVID and rheumatology disease. So I mean, really, uh, I think it's maybe in the last couple of weeks, I've had a handful of patients that came and basically were fine, then were fine, had developed COVID, and soon after developed some inflammatory arthritis. And so joint pain that's worse in the morning, associated with morning stiffness, with some swelling. In one of them, I made a diagnosis of psoriatic arthritis. In another one, we made a diagnosis of rheumatoid arthritis, and another one, polymyalgia rheumatica. So as you can see, they are all very inflammatory arthritis. And they all were asking this really right question, which is it COVID that caused this? And what should I know about this? Can I get a vaccine? What's the story, right? And so I'm going to tell you what we know from the studies that there are. And, COVID has been pretty incredible when it comes to just how, it changed our whole healthcare system. It changed how we respond to pandemic. I think it also changed how we respond to explaining things, really, right? And how to make sure that patients understand that the education related to health, with a lot of misinformation, unfortunately. And also because science is really tricky, and maybe that is why I'm not like someone that has millions of views. It's because as a physician, it's really hard to be black and white. Because it's a lot more complex. Patients are more complex, individuals are more complex, and the science is more complex. But let me share with you what we have found in studies so far. And again, this is the studies as it is. There's been a lot of studies on with COVID. I think there's a lot of valid valid stuff that has been published. But as always, science evolve. So we might change. It might our knowledge might change with time. But as a rheumatologist, from my own experience, I can tell you that yes, we do see rheumatologic disorders starting after COVID. And there was a paper by one of my colleagues from France, actually, from Marseille. I thought it was an interesting. It was a case report, so nothing major, but they presented a case where a patient had mild joint pain, but really not much, and they had checked their CCP, and the CCP, which is a stereomarker for positive rheumatoid arthritis. So that CCP was negative, and then she developed COVID and came back with full-blown rheumatoid arthritis, and the CCP was positive. And basically, it was like, well, is it possible that the COVID led to that positive CCP and then ultimately the full rheumatoid arthritis? But what's interesting is that she probably had a risk factor of developing this rheumatoid arthritis since she had already come before with joint pain. It wasn't full-blown inflammatory arthritis. Since we have, it's been published that people with that develop COVID have more chance of developing rheumatoid arthritis, spondyloarthropathy, inflammatory bowel disease, vasculitis, etc., and so on. And the mechanism is not completely certain, but it does make sense. So, and you have heard me say this several times, but basically, very often in rheumatology, you don't need just one thing that happens to you. Usually it's a two hit. And so maybe you have you're at risk of developing a rheumatologic disorder because of family history, because you've been a smoker, and I'm not you, but maybe someone else, right? Because there's been smoking, maybe because there was a lot of stress, or maybe it was overweight / obesity, right? Like fat tissue is pro-inflammatory. But that by itself is okay. And you don't develop rheumatoid arthritis until one day you develop an infection. So we know, for example, EBV is linked to multiple sclerosis. So that's another autoimmune disorder. It's neurologic. But we know that it was really hard to prove, but it was proven a couple of years ago. And we now think, that it can, some people think that EBV can be linked to lupus, but it has never been, we've never been able to prove that really perfectly, right? Because so many people have EBV or have had EBV. And then we saw, the infection with COVID. And COVID basically stimulates your immune system the way that some young people without any cardiovascular risk factor, any issues, basically died of severe COVID at the beginning of the pandemic, was linked to basically a predisposition to create a reaction to the infection that was out of proportion to the infection. And so basically they died not of the infection itself, but they die of the reaction to the infection. So it's kind of like your body sees this infection and went overboard and like created a ton of fevers, created basically sepsis, and then died of sepsis, even though the infection wasn't that high, right? Like you didn't need to have this reaction to the virus, but some of us had this horrible, really, I want to say horrible because it is really heartbreaking, but basically this, overactive reaction to COVID. And what's interesting is the way we treat that now. We found that, and I think early on, a clinician figured that out. We were giving high-dose steroid, we were giving anti-IL-6, we were giving anti-TNF, which are all treatments that we use in rheumatologic inflammatory arthritis, right? So we use those treatments that decrease the inflammation in our autoimmune disorder and that are very inflammatory, and we used it in this, very active response to COVID. And so the thought process again is that there is this reaction to this infection, and that causes autoimmune disorder, because basically your autoimmune gets activated by the COVID. So COVID activates autoimmune system. And after this activation, your autoimmune system doesn't know how to come down and go back into balance, and can cause rheumatoid arthritis, can cause vasculitis, can cause polymyalgia rheumatica, and so on. And so is it really COVID that causes that? Or is it just that people who would have been at risk of developing an autoimmune disorder like this would have had another infection, let's say the flu, let's say RSV, which, all of those are pretty common. But then, just at one point, there was this COVID pandemic. They all got COVID, and then they developed this rheumatologic condition. So we don't know. We do not know that. I don't know that we will know this in the next 5 or 10 years, because we will have to assess, what's the prevalence, like how often were we getting rheumatoid arthritis, lupus, and so on, and how before COVID, and then in the next 5-10 years, how often did we get it? So did all of the people who were supposed to get those are getting it all after COVID, or did it happen, or did it all happen much more with COVID, and we're still going to see this after? So basically, is it because of COVID per se, or is it, just because of one infection that, at one point you would have had and you would have developed? So anyway, that's the interesting question, which, I think as a researcher, I'm still wondering is it really COVID, or is it just any type of infection? And we kind of like just open the floodgate and then we close, but this water would have gone anyway, right? So that's the question. And then, the other question is, how do you treat? And is this, by itself rheumatoid arthritis, lupus, PMNR, and so on? I think as a rheumatologist, yes, you treat. Because if there's a fire, you put out the fire. It looks like rheumatoid arthritis. It has the positive serologies. You treat like rheumatoid arthritis. You treat it like that. The reason why it came shouldn't stop you, at least not with the knowledge that we have right now. It shouldn't stop you from treating those conditions. So yes, I'm going to treat the rheumatoid arthritis. Yes, I'm going to treat the PMNR, polymyalgia rheumatica. Yes, I'm going to treat lupus or vasculitis, right? And so, yeah, it's basically most of the time it is immunosuppressive. But it's really, that's, I think, what's so fascinating, so interesting. This is why I'm so excited to be a rheumatologist, is that it's not one size fits all, right? Some people with COVID developed RA, some other one developed ankylosing spondylitis, some other one developed vasculitis. And it's not just one COVID, just everyone has the same outcome. And I think that that's what's very interesting. That's like the first one. I would say, like, this is the quote unquote easiest for rheumatologists, because you're like, okay, well, this is RA, I'm treating RA, right? So easy. I think it becomes a little bit harder when it's post-COVID syndrome. So post-COVID syndrome can be associated with, again, it's all autoimmune, and the way our immune system acts on our body is very different from one another. And we have seen that. We see that where some patients are going to develop dysautonomia, where they're going to not be able to regulate their heart rate or regulate their blood pressure. And then that can cause issues on the amount of fatigue, their ability to exercise, their ability to restore their to rest, basically, right? And it's not that there's too much inflammation. It's also not that it's always low. It's not that the sympathetic system is always affected or that the parasympathetic system is always affected, but it's just that this balance, you can't get back into this balance. That's a tricky one. And this, to my knowledge, has been, to me, I find that the best people that have taken care of this have been chiropractors, have been naturopaths, because, or, honestly, like direct care medicine. Like, I have a program where we help patients with this. And, yes, I help, but I feel like my team, we have a coach and a nutritionist and a physical therapist. They are the one who help, and a craniopsychotherapist now, and they are the one who help the most with this, because the idea is to get back in control of our patients' health. And how do we get back into this balance of balancing between the parasympathetic, the sympathetic, the parasympathetic, the sympathetic, because you need to balance. When you're going from a seated or lying down position and you're going up, we want to be able to stimulate the adrenergic system, so your heart rate goes up, right? That this is the normal response. And so that's why you need more time. Like a 10-minute visit with a rheumatologist, that would not be good. So I don't recommend it. And I think that there are very specialized specialty that have time, and that's where you want to go. But that is also immune health as well. Now, when it comes to vaccination, this is where it's tricky, and I think it's based basically on you specifically. So, for example, I had a patient who developed inflammation of the heart after the vaccine, and that has been reported. We see it. We know that it exists. Will I recommend vaccination? Well, it's going to depend on how he's doing. What's the fear that they may have regarding COVID? Where do they live? Do they live in a city? How do they work? Do they work in an environment where there's a ton of risk? Yes or no? And then what treatment are they having? Are they having a treatment that immunosuppresses them, or are they also on a treatment that's going to actually help prevent any infection? So, for example, someone that is on IVIG, immunoglobulin, in a way, I don't think that they need vaccination, honestly, because they're already getting the response to vaccination, right? They are getting immunoglobulin from the community that have already mounted a response against COVID. So for those patients, I don't really see the point of having a vaccine, a booster, especially if they've had a complication with vaccination. So basically, the short answer is it depends. I know it's not the answer you want to hear, but it depends. I would say that if you are on IVIG, you can be pretty reassured that you are protected. And so if you're afraid of getting the vaccine, I think you're okay, and you don't need it. Okay, because you are on IVIG. But short of that, I think it's really a discussion you need to have with your rheumatologist on a one-on-one basis, because it depends on where you live, the fear that you may have, how you have done so far with vaccine and that particular one as well, and so on. Okay. But yeah, they have a role, 100% they have a role, but I think it's a case by case basis. Okay. Hopefully this has been helpful. Please let me know if you're watching this live. Please let me know slash live. I forgot to say that. And then if you're watching this on replay, please watch this replay. I'm soon going to do a webinar on how to decrease inflammation in a holistic fashion. I'm really excited to share this. I really hope you're going to be present. And I will share how our group coaching is going to look like. I'm really, really excited to do this. Until then, I will see you, and I hope you're doing really well, and I'll see you next week. Take care.